Good morning, student. I hope you all are well today. Today, I discuss about a topics shock in fundamental of nursing. At first, we start our class. Our at first, I say you. We today we discuss about shock. Shock is a life-threatening condition. For these conditions, many people can die. So everyone should to know about shock. Now, at first, I discuss about definition of shock. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. This can damage multiple organs. Shock requires immediate medical treatment and can get worse very rapidly. Yes, student, shock is too much dangerous because shock is a life-threatening condition. For that reason, cause that occurs when the body is not getting enough blood flow. And this can damage multiple organs. Yes, for this, if your body have not enough body supply, heart cannot supply too much blood that need your body demand. For these reasons, your many organ can damage. Shock recur immediately. Yes, if any patient immediately shocked, get now he is in shock. We need to immediately medical treatment and can get worse very rapidly. We need to anyhow him and give him consciousness rapidly. The etiologies and causes of shock: heart conditions, heart attack, heart failure, heavy internal or external bleeding or hemorrhage such as from a serious injury, dehydration, infection, septic shock, severe allergic reaction, anaphylactic shock, spinal injury, neurogenic shock, severe burns, persistent vomiting or diarrhea, severe or intensive injury, changes blood vessel as with infection or severe allergic reaction. Severe pain, emotional factor or emotional stress, fright, surgical shocks after surgery, during and after delivery, electric shocks, exposure to extreme heat and cold, bites or stings of poisonous snakes or insects, gas poisonings, poisonous take internally, certainly. There is many types of shocks. Now we are discuss about types of shocks. There are classified into 8 types of shocks. These are hypovolemic shock, cardiogenic shock, septic shock, neurogenic shock, anaphylactic shock, respiratory shock, psychogenic shock, metabolic shock. Now we discuss about the signs and symptoms of all types of shocks. Rapid, shallow, or gasping breathing, cold, pale, clammy skin, rapid but weak pulse, dizziness or fainting, weakness, fainting or giddiness and discomfort. Eye appear to stare. Pupils are dilated. Lusterless of eyes. Anxiety or restlessness or agitations. Seizures. Confusions or unresponsiveness. Continue. Low or no urine output. Bleached lips and fingernails. Profuse sweating, moist skin, shaking and trembling of arms and legs, chest pain, nausea or vomiting or extreme thirst. Blood pressure falls or blood pressures. Blood pressure can be checked, it will be lower than normal. Sunken eyes, lusterless eyes, shaking and trembling of arms and legs. Generally, the patient is very quiet and dustless, but the shock is causes hemorrhage in which patient will be restless and anxious. Continue. Face pale and gray color. Occasionally, occasionally cyanosis. Temperatures will be subnormal, that is below 35 degrees Celsius or 97 degrees Fahrenheit. Unconsciousness may develop. Evidence of associated external or internal bleeding. So, student, now I am describing about the complication of SARS. For shock, there is shock has too much so many complications that lead to a death level. So we know what is the complications of shock. Now I am describing acute respiratory distress syndrome, acute renal failure, gastrointestinal complications, disseminated intravascular coagulations, multiple organ dysfunction syndrome. Now I may describe about the effects of shocks. What is the effects of shocks? We have should to know the effects. Early loss of consciousness that may involves the nerve systems and that may be fatal. Progressive loss of blood from active circulations which may lead to failing heart output and insufficient oxygen to cells that are vital for survival. Sustainable lowered blood pressure which may be death, liver and kidney failure. Now I am discuss about the topics, the most important topics when in your home, in your area, in your institute, any patient is gone to shock. So we need to first aid management after a shock. Now, I described the management of shock, first aid management. So, at first, we must be done reassure the patient, keep the person warm and comfortable place, loosen tight clothing, remove belt and shoes, and cover them with a blanket. Check and control ABCDs. A. Airway control. B. Breathing and ventilation. C. Circulation. D. Disability. Neurological. E. Exposure with environmental control. Student, you say that there is the positioning of the shock patient. When a patient gone to shock, we need to give them supine positions and elevate her leg on a chair, on a tool. Others we can give blow under her legs. For that, if we elevate or we can use our hands to elevate her leg. For that reasons, your increase your blood flow in brain cell that helps to increase your conscious level. So it must be, if any patient is shocked, we need to give supine positions and elevated her leg side. Now, the first aid management, other topics I am describing. If necessary, begin rescue breathing and CPR, cardiopulmonary resuscitation. Even if the person is able to breathe on his or her own, continue to check rate of breathing at least every 5 minutes until help arrives. Do not move a person who has a known or suspected spinal injury. Have the person lie down on his or her back with the feet elevated above the head. If raising the legs causes pain or injury, keep the person flat to increase blood flow to vital organs. Do not raise the head. Open an intravenous IV channel in a large vein and given adequate fluid, normal, saline, Herschel, dextrose. If the casualty unconscious and in case of head injury or suspected internal bleeding, do not give stimulated. Do not give fluids by mouth even if the person complains of thirst. There is a choking risk in the event of sudden loss of unconsciousness. Controlled bleeding by direct pressure should be applied to any wounds that are bleeding significantly. Give appropriate first aid for any wounds, injuries, or illness. Pain should be relieved as fast as possible. Transport as quickly as possible to hospital. Transport as quickly as possible to hospital. Thank you, student, for watching my video or taking the class about shock. That's help you to know more about shock patient. And we think everything in mind as a first aider, as a healthcare provider, as a nurse, as a doctors. We should know the what is the shock, what is the level of shock. And my next classes, I take the many type of class types of shock.